Hi everyone, and welcome once again to Follow Your Heart. I'm Cullen and I'm talking about breastfeeding today. Now, if you are new to the series and wondering why I'm talking about breastfeeding, let me just tell you a little bit about me. I have been a lactation consultant, an international board certified lactation consultant, or IBCLC, for the past 5 years. Before that, I was a volunteer breastfeeding counselor with Lactation for 7 years. So I've been helping mums with breastfeeding for quite a long time. And also I have 15 and 12-year-old boys who I breastfed until they were 3 and 4 years old. So a bit of personal experience too. Breastfeeding for the last 15 years has been a huge part of my life, one that I didn't know was going to be, but that's the way it's turned out. And I love to help you. I'm loving the feedback I'm getting. Some of you saw my video last week about laid back positioning, and I had one person write in to say that she was breastfeeding her 3rd child and she tried what I was suggesting in that video and it worked, and that's great. She's got a little 3-week-old baby and just watching the video helped. So that's why I'm doing what I'm doing, is to hopefully help you through your breastfeeding journey, whether you're still an expectant family, or you've got a newborn at home and this is brand new to you, or maybe you're more experienced and you'd love some support getting through and really normalizing breastfeeding your older children as well. So I'm all for helping you with all of that. So keep your questions coming in and your comments about your breastfeeding experience, and I will help you as best I can here in these. And I also do private consultations. So if you really are struggling, you've got a baby, for example, who's not gaining weight properly, you're just not getting a comfortable latch, please be in touch. There are times when you just need one-to-one support, and I can do that online or in person if you happen to be close to me in New Zealand. So here's what I wanted to say more about the laid back positioning. Remembering that, of course, if your breastfeeding is going great, however you happen to be holding your baby, however you happen to be sitting, if you're comfortable, baby seems comfortable, baby's growing, gaining, you keep doing what you're doing. There are no rules. It's just that I find that in those laid back positions, and watch last week's video if you don't know what I'm talking about, they are in the highlights. I just find it solves a lot of problems. And over the years, how many people I have had say to me, why didn't anyone else show me this? And I really don't know. I really don't know. So I'm trying to normalize that and just be one of the people out here telling you about that great way to position your baby. So watch that. But someone suggested that Sidelying worked really well for them. And of course, experiment for yourself and for your baby. Your baby's different, your body's different, your breasts and nipples are unique to you. You are a unique dyad, okay? So you do what works for you. Sidelying, of course, is great. It protects us overnight, helps us maintain a breastfeeding relationship and get some rest. It can be great in the daytime too. No matter how you're holding your baby, the same principles do apply, however. So we always want baby tummy to tummy with us, both of those hip bones turned into us, not flipped out. Babies like a bit of security with having something that their feet can rest on, especially when they're really young. But really making sure the hands aren't all twisted up, the hip bones are both touching you, baby's hugging the breast. Get in that good position no matter how you are sitting or laying. And remember, it doesn't matter which direction baby's feet are going in. Sometimes you're going to be laying baby more horizontally, sometimes more vertically, sometimes diagonally. It really doesn't matter. And if you're struggling with getting baby's nose out kind of, so they can breathe properly, first of all, like I said, if baby's feeding, baby can breathe. But if it's sounding a bit noisy and snuffly and you want to help baby out, suggest just moving your body around a little bit, moving baby around. Usually you can find a happy place for baby to be and feel like they're breathing a little bit better. The other thing I was going to just quickly point out is about using nipple shields in these positions. And I know, of course, if you're using nipple shields, there's a reason for that, and you probably need some one-to-one help to figure out what's going on and get your feeding more comfortable and without them. Please don't use nipple shields as the very first call. I'm going to do a separate video on that though, so this isn't going to just be about that, but just wanting to point out that if you are using nipple shields currently and you're struggling to get comfortable feeding, you can do these laid back positionings with the nipple shields, and they often work fine because you've got one arm free. When baby's body is laying on you, you don't need two arms to support baby. You just have that one arm there kind of supporting their floppy little head, and your other arm is completely free. And if you need to use it to hold a nipple shield in place, it usually can be done. It is a little bit fiddly. Nipple shields aren't the most fun. I certainly recommend you don't have that as your first go-to. But I will talk about nipple shields next week. So get in any questions that you've got about nipple shields, and next Monday, that will be my topic. And until then, and tomorrow, tune in when we're talking my favorite, sleep. Bye, everyone.